Hi, I'm Katrina Ingram. I recently completed a master's in communications and technology at the University of Alberta, where I looked at the intersection of AI, ethics, and healthcare. And today I'm also going to weave in race, and I'll share a couple of examples of how health data and race intersect and how that leads to ethical concerns. But first, I'm going to start out with a little bit of a backstory. So I used to run a radio station called CKUA Radio, and I was there for close to a decade. But in 2017, I decided it was time to leave the world of media. I went back to school and I took a master's degree in communications and technology. And it was the fall of 2018. I walked into a talk that was being given by a leading AI researcher. And he was talking about all of these harmful things that were happening as a result of artificial intelligence, all these unintended consequences. And I approached him afterwards and I asked him who was working on this issue. And he said, not enough people. And so that kind of led to a self-directed study looking at ethical codes. So this is early 2019, and all of these companies, government and not-for-profit organizations were writing these big 30,000-foot ethical codes like do no harm or promote well-being. And it was really interesting to see that work, but I left my study going, I wonder how you take these 30,000-foot ethical codes and actually make them applicable in the process of developing artificial intelligence. And that really became the focus of my capstone research. So my research really was centered on applied ethics in AI, and I did that within the context of healthcare. So one piece of advice that I was given as I started my research is pick a domain in which to situate your work. And so I chose healthcare. And I picked it because it is this high stakes domain. So there's literally life and death choices being made. And healthcare also deals with some of the more thorny privacy issues because our healthcare data is some of the most personal and sensitive data that we have available. So there's a lot of downside in terms of risk, but also there was a lot of upside potential that I saw in applying AI in healthcare. We could potentially reduce costs, we could deliver more personalized care, we could drive earlier interventions to prevent disease. So there were lots of benefits, in my opinion, if we got this right, but also lots of downside if we didn't. Now, here in Alberta, we were also undertaking the early stages of a project called Connect Care. And Connect Care is about bringing together 1,300 different siloed data systems into one system to form the electronic healthcare record. And so while this isn't exactly artificial intelligence, it's kind of setting the stage to gather all of the data and the foundational elements you would need to deliver personalized care. And in addition to this, CFAR, who's in charge of the Pan-Canadian AI strategy, they were focusing on healthcare as the first vertical that they were going to do some work in. So for all of these reasons, healthcare looked like a great place in which to situate my work. And then, of course, COVID-19 comes along, and all of these issues that I was seeing in healthcare just accelerated. So all of a sudden, we had all these contact tracing apps. There were things being launched across the globe. In some cases, mass surveillance and other controversial methods were being used to track people. Here in Alberta, we also rushed ahead on the stage of virtual care in enabling that with policies and kind of doing things that were implemented very quickly and in ways that didn't necessarily provide for the usual government oversight. So thinking about where we find ethical issues in the development of AI, there's a number of different places. I like to think of it as three big camps. I explain it as data, math, and people. So when we think about data, data is often riddled with historical bias. Sometimes we don't have the right data, so we use some kind of proxy, some other piece of data that we think is close enough. And in doing that, we're kind of encoding biases and taking those biases that are encoded into data and putting them into models. And mathematical models, sometimes we think, well, math is pretty neutral, right? Well, Kathy O'Neill is a famous data scientist, and she wrote the book, Weapons of Math Destruction. And she talks about models being opinions embedded in mathematics. So there's lots of human decision-making that goes into an AI model, and those decisions can encode bias. And then finally, there are people. And when we think about the people who make a technology, they shape that technology in a certain direction. And if we look at AI, it is not a diverse group of people. who make AI. So only 16 to 18% of women, depending on which study you look at, are AI researchers and developers. Google's workforce is only about 2% Black. Most AI developers are white men from a certain socioeconomic background. So there's the people. There's also issues around kind of the politics, let's say, that the people are involved with. Things like funding agendas can determine what gets created. So all of those three buckets are areas where we find ethical issues in the development of AI. Thinking a little bit more about what is healthcare data, what I'm seeing is that healthcare data isn't just the data we generate interacting with the healthcare system. So it's not just the data that you would generate going to see your doctor, for example. So increasingly what's happening is there's kind of these overlapping personas that are being formed. So on the one hand, we have biometric and genetic data, and this is everything from facial recognition, voice printing, fingerprinting, DNA, and all of that information is being gathered in different ways. Some of it maybe through public means and some of it through private means. So we've got that kind of biometric data happening. And then on the other side, we have what I would call your digital persona. So this could be something like your Facebook or social media profiles, all the information that you share about yourself online. So there's lots of information about all of us kind of existing out there in the digital sphere. And increasingly what's happening is all of these different sources are coming together and informing healthcare decisions. So social media data might be useful to determine some aspect of, say, mental health, let's say. So what we're seeing is that people want to use all of those different sources of data and kind of mash them up. The problem is not all of these sources of data are protected the same way. So when we think about healthcare, we think about data protection. That does exist, but it exists for the physical person, that interaction with the healthcare system proper, but not necessarily for these other pieces. So that is something that we need to contend with as we move forward. So this is just a list of some of the what I think are the relevant issues that deserve consideration when it comes to health data. And it's not an exhaustive list. These are just some of my examples. So first of all, we have a lack of medical data for women. Women are underrepresented, they're misrepresented. Most of the clinical data out there is about men. There's this question of should we collect race-based data? So here in Alberta, we've made some decisions around that recently to move ahead in this direction. As you might imagine, this is a controversial area, and it really requires further discussion because on the one hand, having that data can mean perhaps that we can serve populations better. On the other hand, perhaps if it's misused and it's not done in the best interest of the people whose data is represented in that, then we can create harm. So we need to really have a fulsome conversation and debate about that. Biometric data, as I said, are things like facial recognition, your voice, your fingerprints. These are things you cannot easily change. And so these kinds of data sets deserve a special class of protection. And currently there isn't necessarily enough, in my opinion, enough legal protections around these types of data. And they're just being used in ways that I think are not necessarily fully thought through in terms of what the implications might be. Data storage is another issue. So if your data leaves Canada, it's no longer protected. And as we know here in Canada, our healthcare data is governed at a provincial level. And so our healthcare data really has to reside within the province. There's a data authority that kind of coordinates it across provinces. But if, for example, our data is being stored in the cloud and those cloud-based servers are, say, in the United States, then our data is no longer protected under Canadian law and in fact might be subject to other laws such as the US Patriot Act, which gives the American government sweeping powers to look at data when they feel that homeland security, for example, is being compromised. So those are things we need to think about in terms of storage. There's also this question of public benefit and private interest. And I'm seeing this more and more as we have a public healthcare system, but we have all these private players who want to enable virtual care or want to build apps and so forth and want to kind of play in the healthcare space. how do we navigate the public benefit versus private interest question? And we haven't necessarily had that conversation in terms of engaging with Canadian citizens about that. Scaling healthcare data for AI, we may need a national healthcare system. This is my own speculation that potentially this might be moving in a direction of kind of a nationalized system. When I think about scale, AI needs scale in terms of data. I think that, as a smaller country, demographically speaking, Canada may find itself in a position of needing to scale from a data standpoint to really get to this AI-enabled healthcare future. So that's just my own kind of opinion and speculation. And then the last point is this issue of anonymization. So re-identification is something that happens. Privacy is not necessarily guaranteed. There's a famous case of an AI researcher in the States, LaTanya Sweeney, who re-identified the healthcare record of the governor of Massachusetts. And she wound up mailing him his healthcare record to make the point about re-identification, that it was possible. So while there are ways to try and ensure that things are kept more private, it's not necessarily 100% foolproof. So those are some of the issues that I think we need to have more conversation about. I just want to give you a couple of examples kind of centered around the intersection of race and healthcare data. And so this isn't healthcare data per se, but you could see how it could kind of move in this direction. So this is a researcher named Joy Buolamwini. She was a student at MIT, and she discovered that computer vision technology wasn't working to recognize her face. She literally had to code her project while wearing a white mask. And she published her work as a paper called Gender Shades, where she demonstrated that popular facial recognition software did not work well on dark-skinned women. And there is now a movie about this called Coded Bias. It's really good. Next example is from a company called Optum. They're owned by a big multi-billion-dollar US health insurance provider. And they used a model that originally was generated for financial billing purposes. It made decisions around healthcare need based on healthcare spend. So if you spent more money, they thought, well, you might need care more. And that led to discrimination against millions of Black people because they were spending less money on healthcare, not because they needed less healthcare, but because they just had less money to spend on healthcare. And so it was a group of independent academic researchers who found this error in the model. And after a lot of bad press, the company finally did something about it. I'm actually on a team that's writing a case study about Optum. A little bit closer to home, there's a study about the use of names as a proxy for race, and we've recently started to make provisions now for the collection of race-based data in Alberta, but past records don't have that information. So this team is using a person's name to assign ethnicity, and for Indigenous peoples, they're also using postal code because some Indigenous people have European names, and so they're kind of taking these two data sets and mashing them up. So this to me raises a bunch of different questions. The first one is, should we be doing this? Like the purpose of why we're doing this, does it make sense? Secondly, I think about women who change their last name, or people like me of mixed race who have very European sounding names. We would definitely be misclassified in this type of system. And then lastly, I think when I think about all of this and I pull back on it, fundamentally, these questions are about people and power. This woman, Timney Gebru, was the co-lead of the AI ethics team at Google. And this December, she was fired in a very public way that is still playing out. Essentially, she tried to publish a paper that was critical of some practices that are central to Google's business model. And her story has really shaken everyone in the AI ethics community because she is a complete rock star on every level. So to see this happen to her, it's very scary for the rest of us as we try to raise awareness about these issues. So that is my brief presentation. I look forward to your questions during the panel, and I'll stop sharing my screen now and hand the control back over to our moderator.